Hey everybody, today we're going to be going over Chapter 22, Toxicologic Emergencies. In this chapter we're going to go over poisons, various poisons and ways that patients can be poisoned. We'll go over what poison control centers are, how we treat patients who have been poisoned. We'll also go over drug and alcohol emergencies, and also some considerations to take when dealing with various substance abuse. During this lesson, you'll learn also about assessing and caring for patients who have been exposed to various types of poisons. Poisons can be an accidental in nature, or sometimes intentional if the patient is trying to take his or her own life. Many calls to poison control centers do involve children because they have accidentally ingested something. And for certain drug and alcohols, there are special issues that are associated with them that we need to be aware of. Now, what is a poison? It's something that could potentially hurt you, right? It's anything that causes any impairment into somebody's health or causes death by the chemicals. Most poisonings are accidental, but however, some of them can include suicide and homicide as well. Now, toxicology is the actual study of toxins and the antidotes for said toxins. If a patient has overdosed on any kind of drug or medication, this would be an example of a type of poisoning. Now, poisons can enter the body through 4 different routes. It can either be ingested, where the patient has swallowed it, inhaled it, injected it, where it's gone through the skin, or absorption, where it's been placed onto the skin and it's been absorbed that way. Um, Remember that this is also the same for routes that may cause a potential allergic reaction. When a patient ingests it, the absorption occurs through the gastrointestinal tract, and this is the most common route of poisoning. When a patient breathes the poison, typically a gas or vapor, into the lungs, it enables rapid absorption into the body. The poison is transported down the respiratory tract with each inhalation until it ultimately reaches the alveoli. Once it reaches the alveoli, the poison then crosses the alveolar capillary membrane and thus entering the bloodstream, where it is then transported throughout the entire body. When a poison is injected under the skin, it can be injected into the muscle or even directly into the blood vessel. This can result in a local reaction to the poison, which is usually immediate. A local reaction typically causes edema at the site of injection, redness, irritation, and sometimes even pain. Now, a systemic reaction can occur from injection of a poison where it gets distributed throughout the entire body. Absorption, this is when the substance enters the body when it comes in contact with the skin or mucous membranes and absorbs into the bloodstream. Now, the signs and symptoms of poisoning in patients ultimately depends on the type of poison and route of entry into the body. One poison might cause depression of the central nervous system, thus causing bradycardia, bradypnea, and hypotension, whereas another poison could potentially stimulate the central nervous system and cause the patient to become tachycardic, tachypnic, and hypertensive. And the route of entry can determine how quickly the patient presents with any expected signs and symptoms. Now, most of the time when it comes to caring for these patients, it is ultimately just supportive care, monitoring the signs and symptoms. Um, Treatment priorities would be monitoring your ABCs, making sure that the patient has a patent airway, make sure they're breathing adequately, applying oxygen or positive pressure ventilation as needed. Keep a close eye on their mental status because they can deteriorate very quickly, and reassess often. Now, an antidote is a substance that neutralizes the effects of the poison or toxic substance. Many people think that antidotes are available for most poisons. However, true antidotes are available only for a small number of poisons. The treatment of poisons is generally limits or prevents the absorption of the further absorption of the poison, and then manages any other signs and symptoms that can occur. Now, when a patient has ingested a poison, the main thing that we want to try to do is try to empty the stomach of its contents, so that way absorption, it's not as much as absorbed through the intestinal tract. We want to try to determine when the substance was ingested and what type of substance was ingested, so we know what exactly to provide for the patient. Patients may take over-the-counter medications, cleaning agents, illegal drugs, anything along those lines to possibly could ingest. I remember one patient that we went to who drank a capful of liquid Drano, and because of it, it caused him to be killed because of it. The ingestion of poisoned plants is also a common poisoning emergency, especially children under the age of 5. Poisonous plants are not necessarily exotic. They include common household and backyard plants, such as morning glory, rhubarb leaves, buttercups, daisies, daffodils, tulips, and certain parts of the tomato, potato, and petunia plants. A high number of poisonings result also from eating wild mushrooms. Some other common accidental mistakes might be of accidentally taking medications the wrong way, maybe possibly taking it with alcohol. Now, how can EMS providers help reduce the number of accidental poisonings by children? Okay, when we go on scene, we could identify things and point it out to family. Okay. Public safety education seminars. Okay. Suggesting to lock cabinets. Yeah, that could work. There's plenty of stuff out there that could potentially be done. Not when we go to places. Yes, our priority is taking care of the patient. But if we notice something and we have the time to inform them, we could say, "Hey, I would recommend doing this," so that way you don't have to worry about your young one getting their hands on it. When assessing a patient who has ingested some type of poison, you want to make sure that you do a good scene size up. Make sure that you're not going into something that you could potentially get harmed in the process. Go through, check your ABCs, your secondary assessment, go through your history, physicals, look at your signs and symptoms, such as did the patient have a history of these type of acts, any nausea or vomiting, diarrhea, and to alter mental status. Look for any injuries, because certain poisons can cause discoloration or burns around the mouth. So by looking at this child, what would you say is an immediate concern? Right, airway compromise, because you could have potential swelling. And if it's there on the child's face, what tells us that there was none that got inside of this toddler's mouth? Go through your other signs and symptoms. Do they have any abdominal pain, unusual breath or body odors, an altered heart rate, altered blood pressure? Are they comatose or having seizures? Okay. If we have a patient that's ingested a poison, we can consider, pending protocol allows, to give activated charcoal. This medication is occasionally used in the pre-hospital medical care of ingested poisonings. Now, the pre-hospital use of activated charcoal is currently controversial. It should only be administered if directed to do so by medical professionals or a poison control center. Only absorbs certain toxins such as pills. Does not do very good with. We do not want to give this to any patients who's ingested any type of acids, because it could potentially cause further issues. There are several brands of activated charcoal that you might see, so make sure that you know exactly how to use it. As you're going through care, like with most things, you want to make sure that you maintain a patent airway. And protect them from aspiration. Definitely if you do give activated charcoal, because there is a chance that they may vomit. If they're not ventilating properly, make sure that you assist with positive pressure ventilation. And then transport the patient immediately. Try to get them in a position where they don't cause further injury. If you're able to, bring the substance to the hospital with you. Even if the bottle is empty, go ahead and bring it with you. If it's full, put the cap on it, take it with you, so that way they can figure out exactly how much of the substance that they ingested. With inhaled poisons, many poisonings due to inhalation do occur as a result of some type of fire, because of the gases that is created from of it. Thousands of people do die every year due to inhalation poisoning, and the longer a patient is exposed to the substance, the worse their prognosis, because as it continues to absorb into the body. Some poisons that you might come across that patients have inhaled might include ammonia or chlorine gas, carbon monoxide, carbon dioxide, sulfur dioxide, dry cleaning solvents, fire extinguishers. All of this is stuff that could potentially hurt you. Um, Carbon monoxide and it's not on here, but cyanide are two gases that are given off during a fire. So if you don't have the proper equipment on, you could potentially inhale those gases. Some poisons are inhaled intentionally to get high. Patients who inhale paints and propellants are commonly referred to as huffers. The toxins are inhaled in a variety of ways to produce certain expected effects. These substances can have many effects as they displace the oxygen content within the alveoli, thus leading to hypoxia. Some things that are commonly abused might include paints, freon, glue, nitrous oxide, and even gas propellants. When coming up on a scene that you suspect of some type of inhaled object, you want to go through your very proper scene size up. Look for any odors or fumes. And keep in mind that some are colorless and odorless. Look to see if you see anything. Are there any birds down, vegetation appearing to be dead? If hazardous, give me 1 second, guys. Sorry about that. Do you see any placards that can help you identify what's going through? If it is safe for you to enter, go through your primary assessment. Ensure that you have ABCs, patients able to breathe adequately. And as you can see in this picture, apparently there's gases involved. So they had to go in wearing their SCBAs to ensure that they were able to get in, get the patient, and get out. If you do have a patient that was involved, that was exposed to some type of inhaled poison, you want to try to place them on high flow oxygen, so that way we can try to get oxygen back in to replace the oxygen that was deprived. As you get done with your primary assessment, start going into your secondary. Go look at your signs and symptoms. Do they have any difficulty breathing, any chest pain, cough, stridor, any abnormal respiratory sounds? Find out how long they were exposed to the toxin and try to figure out what toxin exactly, so that way we know the proper treatment for them. Do they have any confusion, any copious secretions or headache, dizziness, or are they having seizures? Look around their face or lips. Do they have any of the substance around their face or lips, or any signs of respiratory tract burns? This is definitely something you want to look for in patients that just recently got out of any kind of fire. You want to look see if they might have gotten any kind of smoke or smog, anything like that that they breathed in, or flames directly in front of their face. If you're unable to go in, protect yourself. Stay as far as you can away from the scenes that you don't get involved. Also, if you do have the proper equipment, either use an SCBA or appropriate rescue team as needed to go in. If the patient is awake and alert, keep them in a position of comfort. Make sure you maintain ABCs. If your patient was inhaled some type of poison, you want to apply them on non-rebreather regardless of their SpO2. Any information that you have, drug information, placards, bottles, anything that you can take about the substance to the hospital, take it with you. Now, injected poisons, this is involved through some type of break within the skin. This can be caused through intentional injection of a drug, such as methamphetamines, or through an insect bite or a sting. This can cause either a local or systemic effect. And if it's due to an insect sting, if you've been such as a bee, a wasp, usually you'll have anaphylactic-like reactions. When going through, you want to do a good scene size up. Figure out what exactly was it that the patient was injected with. Look for any drug paraphernalia or indications of bites or stings. Go through your primary assessment, go through your ABCs, check your mental status, go through your history and physical, and ask them questions. Is there a history of drug use? How long has it been since you were exposed, and the onset of signs and symptoms? And if it was due to some type of animal or insect, what was it? Now, this is a type of bite that we're going to see quite often in our area. We have rattlesnakes in the area. Okay? To determine that it's a rattlesnake bite, usually the bites will be close together. There will usually be 2 bites. Every now and then, the snake might only get 1 fang in, but for the most part, there will be 2 nearby bites. During your secondary assessment, try to get a history from the patient and or bystanders and as much information as you can about any substance that might have been injected or about the kind of insect or animal that might have inflicted a bite or sting. Go through your signs and symptoms, just like everything else. Do they have any euphoria? What's euphoria? Right, it's a feeling of excitement. Okay, they feel like they're on cloud 9. Do they have any dizziness, fever, nausea, vomiting? Do they feel sedated? Check their pupils. Are their pupils sluggish? Look for needle tracks. They have any trouble breathing, paralysis? Okay. Protect yourself if they were injected by some type of insect or animal. Make sure that the scene is safe. Make sure you're not going into somewhere where you're going to get stung or bit. If it was needles, clear the area. Make sure that you don't accidentally get stuck. If the patient's breathing adequately, maintain their airway, but be cognizant that they may vomit. If they're breathing inadequately, provide positive pressure ventilation. Transport the patient very rapidly. Absorbed poisons, these are those that enter through the skin, either through the skin or through mucous membranes. Usually these will cause irritation or burns to the area. And depending on the type of poison and how much of it gets absorbed, it'll either cause a local skin reaction, a systemic reaction, or both. Now, when you arrive on scene of a possible absorption-like poisoning, you want to make sure that you do a very thorough scene size-up. Make sure that you take the proper protective gear on as needed. Keep an eye out for any containers or plants in the environment because there's more and more coming into our area every day that we need to be aware of. Excuse me. If you go after you get done with your primary assessment, go to the secondary. Look for any poison that may be on the patient or his clothing. If it's a dry chemical, brush it off. Go into your secondary, go into your history, physical exam. Look at your signs and symptoms. Is there any traces of powder or liquid on the skin? Any redness, swelling, skin burns or itching? Is there any fluid-filled oozing blisters? Now, if they have blisters, do we need to pop them? No, we do not pop blisters. Is there any signs and symptoms that the patient has come in contact with a poisonous plant? Usually you'll be able to see kind of like an oily film on them from where it got onto them. If you see any of that, you want to try to wash it off. While wearing gloves, if the source of the poison is on the patient or their clothing, you want to remove of it with gloves on, so that way you don't turn around and absorb it yourself. Make sure that you maintain a patent airway. Make sure that you maintain an oxygen saturation of at least 94%. If it's gotten into the patient's eyes, you want to rinse it out in that medial to lateral fashion, and then reassess and transport the patient appropriately. As mentioned, if they have a dry powder on the patient, you want to brush it off with some type of brush. And then after you do that, use some water that's clean to wash it off, the remainder off the patient. The reason being is a lot of these chemicals, these dry chemicals, once they come into contact with water, that's when they'll begin their process and they may actually cause burns. So you want to try to get most of this off prior to that. If the poison entered the eye, we want to irrigate it for at least 20 minutes in that medial to lateral fashion. Try to keep the patient in a position so that water runs away from the unaffected eye, taking care not to spread the contamination. Something that you can consider doing for a patient that has a type of burn to the eye, so that way it frees you up to be able to do other stuff as needed. You can take a nasal cannula, and this works great if you're having to do both eyes also. Hook your nasal cannula up to a bag of normal saline through the IV tubing. Open it up, and you can then flush it that way. And it does place the nasal cannula on the bridge of the nose, and it'll flush out that also. Food poisoning is caused by some type of bacterium pathogen within the body or within food, which then once eaten causes toxins to be released. Food poisoning is increasing in incidence because of food not being prepared and cooked properly. One of the most common sources includes seafood, eggs, ready-to-eat foods, so your microwavable foods. Some common types of poisoning include salmonella, which comes from contaminated food and water or even undercooked food. Campylobacter, this comes from contaminated poultry, milk, and water. E. coli, this is a severe GI poisoning that's coming from a variety of contaminated foods, untreated water that's contaminated with E. coli, and even undercooked foods. Staphylococcus aureus is from unhygienic food preparation and is usually associated with foods that are served cold, such as desserts, custards, and salads. Signs and symptoms of patients that were involved with food poisoning depends on what exactly they were poisoned with. It can include fever, abdominal cramping, bloody stools, muscle cramps. Treatment of these patients, you know, just follow general guidelines. Um, Try to keep them comfortable. Monitor your signs and symptoms. Ultimately, that's how we're going to have to treat it. Try to make sure that you maintain a patent airway. Be prepared for the patient to vomit. Try to keep that O2 sat at least 94% as well. Alright guys, we're going to take a break right here. Stretch your legs, use the restroom, whatever you need. We'll pick back up with carbon monoxide poisoning.